Welcome back to part 3 of clinical software training, Medinet. We've stopped with renal function calculator. Next tab is Pathology Request. You can choose which pathology you refer to, what kind of test, and what was the reason. You also have some favorites on your right hand side. You can choose. Then press print and pathology request will be printed on a special paper. Radiology. Radiology request. Ask you which radiology you'd like to refer to. What for? What kind of test? You see, I double click. I double click on reason. Of course, the reason doesn't match the test, but it is not the purpose of this exercise. See? You can add some more tests, some more reasons. Again, print or print and close. You've got your request. This tab allows you to email a letter to the patient. This tab allows you to email to the referring doctor or send message to the patient, SMS. This tab allows you to make a recall. New recall. You can always mark it patient returned and archive. And add reasons for recall. You can use all sorts of tabs. This is electronic recall system. Australian accreditation requirements require patient to be called at least 3 times at different times of the day before certified mail is sent to the patient. This is done for medical legal purposes. We will do recalls a little bit later. At the moment we're just looking around of what's available in clinical software. This is for making reminders. Reminder is different from recall. Reminders are mainly used for preventative care, such as immunizations, pap smears, and chronic disease management. You can always make a new reminder. Choose the reason. Okay. Invoices. We don't use these invoices or show appointments. These tabs are used only when clinical software is incorporated with admin software, so we don't worry about it at the moment. MIMS. MIMS is Australian medication information. Remember we prescribed Panadol for this patient? This is all the information about Panadol. Storage, presentation, overdose, actions, indications. You can search some other medication. Lasix. And again, you can find all the information about Lasix. It's very important. This button, Consumer Medicine Information. Essentially, these are leaflets that are inserted in a box with medication. You see, this is the leaflet for the patient, all about Panadol. You can print it out, give it to the patient as a part of patient education. This is Medinet Ref. Medinet Ref is a very good system. As you can see on your left hand side, you have all the medications by group. Let's press on laxatives, and you can see all the laxatives that are approved and available in Australia. You can prescribe, or you can see details of that medication. Is it authority? How it is classified according to the pregnancy code? Dosage? Antidiarrheal? So all bodily systems are covered here. Vaccines, it was Medinet Ref. Okay, now we've got reminder for this patient. Buzzing. Oh. All sorts of options. Right. Recall. There is an active recall for this patient. Now it disappeared. This little airplane here. This is travel vaccination guide. Travel medicine by country. Let's say someone is traveling to Argentina. That's what kind of immunizations the patient who is going to travel to Argentina will require. It can be exported to PDF and printed out, or just printed out, or export to the letter, or email, or travel medicine by region. What if someone goes to Central America or Caribbean. That'd be lovely. Patient handouts. This is patient education. All sorts of leaflets. Let's say this one, first aid for asthma. Or these ones. Eventually, you will have your favorite ones. You can print it, give the patient, and explain. Print button, address book, where all the referrers, or doctors to whom we refer rather, and we keep this address book up to date. And a quick search, so you can open another patient. Top menu, patient. You can quick find duplicates, close all the patients. Summaries. You can produce summary for this patient, all sorts of summaries. Let's say you'd like to print out all progress notes, or all results, or complete record of this patient. Let's try. You see? Now we have complete record for this patient. Demographics, medications, progress notes, results, and previous prescriptions. Summaries. Full summary, full history, health summary, summary of immunizations, limited history, medications, patient drug chart, nursing home medication chart. You can choose what you need. These are all in summaries. It is important to know where the summaries are. It is often that we give patient summary to the patients, just in case of emergency. So patients who are at risk of having an emergency situation carry their health summaries with them. It especially applies to elderly patients. It is part of annual health assessment that nurse or a doctor issues patient with full health summary. It is very important and helps patients to be safe and get help from emergency people much better, much sooner. Thank you. See you in part 4.